Hi, my name is Robert Lopez. Today I'm going to be talking about my capstone project that I did this summer for my Bachelor of Science in Nursing program for my leadership class. Here is the poster that I did for the project, and I will just be discussing that, and then I'll be going into an S-bar about my project to be able to clearly communicate what my intentions were. The name of my project was Real-Time Charting, a Quality Improvement Education Resource. The purpose and intent, charting by exception is how documentation is done at a local community hospital where I completed my project. Included in charting by exception is real-time charting, which helps reduce errors in documentation and ensure accuracy of charting. The purpose of the project is to compile peer review and best practice articles to develop a bulletin board, an electronic resource, and reminders posted at the computers on a specific unit. And these will directly benefit the facility by providing efficiency in real-time charting, and results will be disseminated to nursing staff and caregivers. The goal and benefits. The goal is to encourage the team members to chart at the bedside in real time. The benefits of real-time charting are to ensure accuracy in documentation and to reduce the potential for leaving out pertinent information from the patient's chart. Charting will be more accurate, timely, and without omission, and charting by exception will allow for increased time to provide direct patient care. I will go over some of the tips and tricks that I've found when I discuss my S-bar. So the S-bar, situation, accurate and timely charting is the expectation for documenting in the acute care setting at the place where I finished my capstone project. It has been proven time and time again how charting by exception and real-time charting diminishes redundancy in documentation and reduces pertinent information being left out of the chart. It helps to increase nursing staff's availability for direct patient care, and it helps to significantly reduce errors in documentation. This in turn helps produce better patient outcomes by allowing less missed issues and allows the members of the care team to have an accurate picture of the patient in real time. The assessment was, as it is the expectation to chart as close to real time as possible, some of the nurses at the facility, myself included, had gotten used to charting after the fact, or after completing our tasks or assessments, sometimes long after. And so this was something that we needed to address, and something that my manager specifically wanted to address. And that's how that's how the project came to me, and that's how I decided that this is something I was going to be working on. So I wanted to make sure that this served as a reminder to all staff who document on patients, to ensure that we are charting real time or as close to real time as possible. Some tips and tricks and reminders are as follows to help create new habits in our documentation process. Have the patient participate and partner with the RN in the assessment process to ensure accuracy and help build rapport and trust. This will also help to increase health literacy in the patients that we serve. Open the patient's chart prior to starting education, our head-to-toe assessments, and our activities of daily living. We'll use the EMR as a reference guide while assessing and educating our patients. We'll chart by exception and real-time charting. In real-time chart the abnormals, vitals, and I's and O's right away to ensure that these are not being skewed or missed, and that they're more accurate, as these are hard numbers. We use members of the healthcare team to chart within their scope of practice as well, by using delegation when necessary or when appropriate. We'll update and personalize dot phrases or templates to help increase efficiency and ensure we are not missing aspects of the plan of care. We'll Overall, accurate charting helps to increase visibility of abnormal patient assessments and or adverse event occurrences. This allows for interventions to begin sooner if necessary, if the patient is needing some more further interventions. I am really looking forward to the impact that my project will have on my organization, and I am looking forward to increased patient satisfaction and better patient outcomes because of my project overall. I want to give a special thanks to my preceptor, Shantae Madsen, for her guidance and support through this project. I also want to give a special thank you to Susan for your increased help and support through this project as well. Thank you guys.